Dr. Annie Armstrong here from Head to Toe Spine and Sports Therapy, and I'm with Dr. Rebecca Hoppins from Seattle Naturopathic. This is an amazing topic, and Dr. Rebecca Hoppins is an expert in it. So we are going to talk about food allergies today, and how they can really negatively impact your health. And I think no matter what stage of your health you're in, that food allergies can have a huge impact. We notice it a lot. We've worked together on it a lot. I'm not going to do all the talking today. Our camera is crooked, I've noticed. Good thing we're getting this way. So I apologize for the wobbly start. And I'm going to start with this question. What are food allergies? And specifically, so in general, what are they? And what's the difference between the two types of reactions? We get the reactions where when we eat a peanut, our lips get huge and we swell up and we're instantly, we need a shot of whatever it is.
Epi.
There you go. Or there's the kind we don't really notice until we eliminate them, which are probably the bigger one, right? I would guess.
More common for sure.
Yeah.
Okay, so food allergies are an immunological reaction to a particular or several particular foods. And they are, what we understand to be a food allergy by definition is something that is mediated by an antibody called immunoglobulin E, or IgE. And those are the least common ones, but the ones that people are most familiar with, like Dr. Annie mentioned, peanuts, shrimp, and so forth, that cause symptoms like angioedema, where the lips and the eyes will puff up, eczema, hives, body swelling, and anaphylaxis, which is can be lethal. So that's
when
where
you
people
die from food allergies.
Yeah. So that's when you need EpiPens, multiple EpiPens, and steroids usually to get over that. And those are kind of on the rise, because people are dealing more and more with those. Like even schools are banning peanut butter and peanuts in some of these grade schools, which just seems really intense, and teachers are trained on how to use EpiPens. So food sensitivities are mediated by IgG antibodies, which is a different cell, a different type of white blood cell than IgE. So IgE are produced by mast cells and eosinophils, and IgG antibodies are typically produced by lymphocytes. So these are the cells that are supposed to be creating antibodies to bugs, bacteria, viruses, and so forth. So the response is much more muted. So you could be eating something a couple times a week and have the same symptoms all the time, and just that's the way I am. I've always had this problem, whether it's having eczema or psoriasis. It's just the way that I am. My parents had it, or my dad had it. It's something that can be happening on a low level all the time and fairly predictable for the individual. So they are slow. The IgG-mediated reactions tend to occur within 2 to 4 hours. They can be immediate, but the IgG, the real allergies, are usually immediate or within 2 hours, though it can take 48 to 72 hours with IgG. So if you eat something on Monday and you don't have a reaction related to that until Wednesday, how are you going to be able to correlate this to something that you've had or something that you eat on a daily basis?
Okay, Smarty Pants, that was way over my head.
Sorry.
All right, so let's break it down a little bit. So I think really what most of us are probably worried about is the IgG. So those are more considered our food sensitivities, right? So that's what we're sensitive to. We're not aware of it. And so I think from hearing you talk before about this, it's going to increase, if we have a lot of things we're eating that we're sensitive to, it's going to generally perhaps increase our overall inflammation.
Inflammation, yes.
And it's going to increase our histamine response. Is that right?
It can.
Or increase our histamines, really.
Yes, it can.
And so what we might be feeling is perhaps, I guess we could be bloating. It could be body tender. We could be experiencing joint aches and pains.
Yes.
Definitely, you mentioned the skin breakouts like rosacea, maybe increased eczema, those sort of I guess rosacea is not autoimmune, but eczema certainly is autoimmune. Certainly gut stuff, that bloating.
That's a big one.
And discomfort, maybe not after eating, maybe just all the time, poor sleep. I think maybe perhaps night sweats.
Yes, it's an unending list because
it's a never-ending list.
Because
right?
it can affect any body system. There's nothing that it can't affect. So yes, the biggest things that I see are the gut symptoms, because that's where the initial reaction starts to take place. So most people are aware of that. But yes, eczema, psoriasis, so any sort of skin thing, including acne, headaches, migraines, menstrual problems. I've seen like things like fibromyalgia or other muscle issues, rheumatoid arthritis. So we can see rheumatoid conditions be treated, reverse, or slow down significantly by removing foods. And it's not just things like nightshades. There can be a specific allergy to something like that, but there's for some people there's just a sensitivity to certain chemicals that are in that. That's different from a food allergy per se. Yeah, okay. So it can affect anything.
Yeah, I think it's tremendously interesting. And just a little backstory. When we first met on Craigslist, right?
Craigslist.
Those of us who know us know we met on Craigslist, and we started working together.
Yeah.
And I remember sending you a patient I couldn't get better, and she was just one of these people who was her whole body really hurt her.
Yeah,
I remember her. And it was really hard for me to work on her because her muscles were so tender. And she was just like. She was so tender, and she just didn't resolve. She didn't respond well to treatment. She didn't resolve. She had hip pain, if I remember correctly, and she just wasn't getting better. And I was like, well, what do I do? She's had an MRI, she's had an X-ray, she's been to the doctor, she's had injections, she's had
and she was on lots of medications for pain.
And nothing was hitting it. And so I just remember sending her to you, and then a couple of weeks had passed or so, and then one day she popped into my office and she goes, I just want to tell you I don't need you anymore because I don't hurt at all anymore. And it was food allergies.
Yeah.
And that blew my mind.
Yeah.
It blew my mind.
Yeah. So I remember this case. I think she was probably in her 50s, early 50s.
Yeah,
so there might have been a menopausal component there too. But we had chosen to do, she had a lot of stuff going on. So in cases like that where people have many, many, many symptoms, I think of, okay, the cost of food allergy testing and what that's going to take versus taking a whole bunch of supplements. Let's just remove. Let's see if we can remove some triggers first and make this easy. So typically what happens when I do some food allergy testing on somebody, if they follow it really, really well, generally in the first month, they tend to be about 50% better or more. And so she came in and she was pretty happy. She said, yeah, I think everything's about 30% better. And I was like, I wasn't satisfied with that. But in 4 weeks, she had also come off all of her medication. She was on 3 pain medications.
Wow.
I think that included muscle relaxers, and she was off that and 30% better, and she just kept getting better. So it was a pretty incredible case, and I think it was the one that really turned you on to the whole food sensitivity.
It blew my mind because I was always dealing with people that I knew their tissues weren't right. I mean, that's my touch, right? My palpation, and I can feel, and it hurts them. Just even the lightest of touch hurts them, and they have this sort of general myalgia. It's like, well, how do you feel today? Well, my hip hurts, my elbow hurts, my knees are kind of sore, my ankles are bothering me, my neck is killing me, I have a headache, and I'm like, wow, I can't treat all those areas in our time together, and it hurts me. It hurts you, for me to touch you. So. That to me it really blew my socks off. So I think I want to go back to what you said about for people starting out, even if, as you know, I'm on the Whole30 right now. I haven't had any fat and wine with you for a while. So I feel fabulous. It's been 9 days, I guess I've been on it, right? And the Whole30 is a pretty big elimination program. It eliminates sugar, which is, as we know, a huge inflammatory food, and then it eliminates the top dogs, the soy. At least I think they're the top dogs, and you can correct me. So it eliminates soy, gluten, dairy, all grains, sugar, alcohol, sad face.
But you can still have caffeine, right?
You can still have caffeine, which I know not all cleanses, go against. But I do feel better, and I thought I already ate pretty well.
Yeah,
I'm pretty clean, but I feel better. So what it means to me is something in what I'm eating wasn't doing my body well. And so when someone starts out with you, are they able to sort of as you said, if say they don't, I know the complete testing is pricey, right? It's not over the top, but it's expensive. And so do you ever feel comfortable having someone just do an elimination? And how does that work?
Yeah, so there are a number of options. So it depends on the individual. I think everybody can benefit from getting the full panel done. If for being cost prohibitive or even taking out, sometimes it's 20 or 30 foods that will test positive. The lab average is 24 for the one that I use. It's a 154 food panel. An elimination can be done where you just select certain foods to take out. So it's a bit of a crapshoot, but for a lot of people it works. Since I've done enough of these, I have kind of a top 10 list that I can have people take out, and the vast majority of them are going to be things like the yeast, wheat, dairy, eggs, and a couple other foods. Yeah, that's a tough one. Chicken, eggs, and I have some theories on why those three are so common. But that's where people tend to get the most bang for their effort on taking those out, but they're also the most difficult ones to take out. So it's also a good test to see how can somebody apply this to their life. If they can do that for 2 weeks, then perhaps they would be a good candidate to do all the rest of them, because taking out 20 or 30 foods, I've seen as many as 48 in an individual, and then rotating the other foods is tough. And we do the food rotation so that we don't develop a new sensitivity while we're removing these other triggers because of the causes of food sensitivity.
It is really hard, though. I mean, I think back to just say someone is watching this and they just want to test themselves. So they eliminate the top ones, so eggs, dairy, and gluten. You're saying take those out. And then how long do they have to leave those out of their diet before they reintroduce? And how do you do that carefully, and what should you expect?
Yeah, so it depends on the individual. Generally, the younger the person is, typically 2 weeks would be enough for, say, a child, a young child. Anybody going through or hitting puberty, things start to change a little more, so it would be a minimum of 4 weeks.
So 4 weeks for us, like
minimum.
Between 30 and 50.
Minimum.
4 weeks with all those foods out before you even test them.
No. That's to take. Oh, yes. I'm sorry. So the test would be, so you don't eat them for 4 weeks, and then you challenge them. You eat them again.
Yeah,
so one at a time.
Oh, that's interesting. Okay.
Yeah. So when we do the food allergy testing, we'll do 90 days. And that also gives a chance for the body to recover from some of the, I'll call them secondary. Generally, it's going to be 3 to 10 foods that persist as a food sensitivity, or that will, when you re-challenge them after about 3 months, you're still going to have a response. So it's not only a diagnostic elimination and challenge, but it's also a treatment. And that's the cool thing with the IgG sensitivities is if you remove them long enough, whether it's 3 months, 6 months, a year, or 2, you can then tolerate them again. So it's not that it's forever, but or you might have some limited tolerance for something, like maybe you can have it once a month. So you can go and be social. You can you don't have to be completely a monk about stuff for the rest of your life. But there are some foods that continuously will cause people problems. So they'll keep them out for life for the most part.
Okay, that's really interesting. And then when you, I remember we saying when you do go to challenge it, like I think I'll probably wait another week and then I'll challenge eggs, which is one of my issues, right? I have a hard time with eggs, sadly.
They're a great nutrient.
They're a great nutrient. And eggs are weird. So maybe we can talk a little bit about eggs, because I've heard different things. Like I've heard people say that if you bake with an egg, it becomes kind of a different type of allergy than if you just eat a scrambled egg. And I'm totally confused by that. But so for me, if I wait another week, that's 2 weeks without eggs. I should probably wait a month then, you're saying, before I challenge eggs.
I would, yeah.
Okay, so I'll have to go back to that one. But then I would eat like a ton of eggs that day and wait and see what happens. Is that right?
Sort of. So with eggs, the nutrient-wise, I just want to speak to that. What we get in like the yolks are fat-soluble nutrients that we don't really get in a lot of other things, because we don't eat organ meats anymore very much. We used to eat the entire animal. There was no room for any waste. So we're missing a lot of that. Plus there's a lot of choline, which is something that the liver really needs, and you can get almost a tablespoon of that out of an egg.
That's amazing.
Not to mention the proteins and all of that. So, and we're injected with chicken egg albumin when we get our vaccines. So and those are proteins. So it's my theory that that's why we see so many chicken egg sensitivities, because
Is albumin
developing
the white or the yolk or both?
Albumin, the white.
Right. So can you eat, because most of the nutrients in the yolk, right?
Well, it just depends on which nutrients you're looking for.
Well, so, you made me take that terrible tasting powdered polyacetylcholine or something like
phosphatidylcholine.
Yeah, because you say that's what I'm missing when I don't eat eggs.
Yes,
and it's gross.
Yeah, it's in eggs and meat. But it's very important for the liver and for the cells. Yeah. All the cells in the body, because that's what our cell membranes are made out of. With challenging eggs, that's chicken eggs. So that's, of course, what we eat the most of. Yeah. So that we're more likely to have sensitivities to that. So I'll have people switch to duck eggs if they're available and just see if there's a difference. Mm-hmm. So in challenging the eggs, sometimes people are sensitive to the egg whites versus the egg yolks. So like doing a hard boil and testing one separate from the other.
Oh, interesting.
Is a good way to go about it.
Interesting. Yeah.
And more people tend to be sensitive to the egg whites. And what's everybody doing for health? They're eating egg whites, egg white omelets and so forth, because it's low fat. But we need those fats, because those are the good ones. Those are the omega-3 fats.
Yeah, we know fat's in.
Yeah,
fat is totally in.
Fat's totally in.
Thank
it will always be in.
Yeah, always in. Okay, that's interesting. So that's the main tip. So if you want to do an elimination, then you want to do it for 4 weeks.
A minimum
of the top dogs, 4 weeks, and you're really looking to start feeling better. Right?
Oh yeah.
I mean, I remember when I did the food panel with you, and it was 150 foods that were tested.
154.
And I had like 30. I don't know. I had a lot, and they were my favorites. They were avocados. They were almonds. They were I don't remember what else, but a bunch of stuff that I ate all the time. Mm-hmm. And so you said eliminate until you feel better, and avocado. I mean, that was
weird.
That was my main go-to, and I remember that it would make my face go numb.
Yeah, that was scary.
Kind of intense, right?
Yeah, that was scary.
Yeah, it was scary. It was really weird.
Yeah.
And now I don't have a numb face anymore, and I can eat avocados.
And you can eat avocados again.
So so it's all good. So are food allergies more prevalent today than they were, say, 20 years ago, or are they just more in the hot, in the know, and more diagnosed? Or what is your feeling on that?
So I don't know the facts on that, but I think just because there are more, naturopaths talking about this in the world, more per capita, it's coming into the public consciousness more. So in my practice, the vast majority of my patients have some sort of food sensitivity that they are aware of. So they know if they eat this, they're going to get this rash, or if they eat that, they're going to have some sort of gastrointestinal response, including whether it's bloating or bowel changes or reflux. So those are some of the biggest ones. And another interesting one is chronic sinusitis. People with chronic congestion, and they think it's allergies. Well, actually, it's reflux that's causing that causes the chronic symptoms. So we address that. So a very interesting thing, particularly with gluten, which seems to have been coming into the public consciousness. There was this, can I cite another podcast? There was a Freakonomics, I forgot the name of it, but it was a Freakonomics podcast about celiac disease. And the long and short of it, it's on the rise now because people are surviving it because we have the medication. Because if people who had celiac died, what had happened in World War II in Holland, there was a physician who was treating these people with this condition, and when the trains were blocked from going into Holland with grain, people were starving. They were literally eating grass and the tulip bulbs. So the people who were thriving were the people with celiac. They would do better because they weren't doing that. Yeah. And so anyway, he came to the U.S. and found that the prevalence was they thought it was 1 in 30,000, but he got went to the Red Cross and bought 6,000 samples and found of blood from different people, because the Red Cross blood donation bank was there, and it was 1 in 132 people had antibodies to gluten. So it's really high. So now that medicine has gotten better and people are living with celiac, that genetic pool, we're seeing more and more people surviving and passing that down. So that was in the 40s. So coming into the 70s, when people started moving into vegetarianism and veganism, and there was much more grain consumption, we saw more and more of these this celiac and wheat sensitivities. So That's a little bit of the evolution in the last century.
I think that's
why
really,
we see more of that.
Yeah, I think that's a really awesome thing to point out, because it is funny, because it's really on the rise, and a lot of people think it's just this is just a trend fad that we're talking about now. I can see that, because it's not, we aren't in the evolutionary phase where the strongest survive. The celiacs, aren't dying.
Right.
We're surviving and moving forward. So I guess the other thing, whenever I've been to Europe with you, and everyone always says, well, the wheat's fine in Europe, but obviously that's probably not true. I heard that celiac disease is also on the rise in Italy, which I guess gluten-free pasta will be making a comeback in Italy.
I'm sure. There's more wild types of grains in Europe, whereas we have this like winter white or soft winter white.
Soft white wheat.
Here, and so it's a monoclonal thing. So we're all basically eating the same clone over and over and over again. So that's a plug for organic, for one. But the other thing is, generally people in Europe are more healthy. They don't eat as much. They walk a lot more. They have a better quality of life, and all of those things reduce stress. And reducing stress improves digestion. And that brings us to the cause of food sensitivities, and that is intestinal permeability. So we're supposed to be absorbing nutrients through the cells, but intestinal permeability occurs when food goes between the cells. So we have like an enterocyte here and an enterocyte here, and they kind of look like that with their little villi, and in between are these tight junctions. There are these collagen locks between these cells, and things like gluten for certain people, well, a lot of people, increases a chemical called zonulin that breaks through that. Another thing that does that is black pepper. That was one of the things that's on food sensitivity testing that tests positive all the time. I just couldn't understand why this was coming up so much, because it blasts through that. And that's one of the reasons why black pepper is used in a lot of formulations to increase absorption. So stuff is getting into the bloodstream, but it's because it's blasting through these cells.
Just a note on that. I mean, for all of you taking the turmeric and pepper.
Turmeric's great. Don't do it with pepper.
Turmeric's great. Don't do it with pepper, because that seems to be the rage now. So you have to have pepper with your turmeric to absorb it. And I have been telling people, please don't do that. So you want to use it with phospholipids. So that's something that will diffuse through. And that's
Oops, we did it again. So that's the microphone. Where were we at? Okay,
we were at black pepper.
Black pepper. We'll just hold that here.
I'm going to get this back in. Sorry, everybody trying to watch and enjoy this.
So, live video at its best. Okay, I'm going to hold my hands still this time.
Okay, this is going to be better.
There we are.
All right.
Okay.
So no black pepper and
no
turmeric.
Sudden moves.
And no sudden moves. So food allergies. So you diagnose. I mean, I know you have people do elimination if the blood panel is kind of out of their realm.
Yes.
But if they can't afford it, or maybe their insurance picks it up, then you have them do basically a blood test, right? And that blood test then diagnoses their food allergies.
Yes.
And then they go through a protocol of eating what is on their okay list.
Yes.
Right? And then rotating that okay list.
Yes.
Okay.
So the reason for that is, if with that intestinal hyperpermeability, if you put a new food in there frequently, you can develop a new sensitivity. So it's to limit the amount of exposure of any one food. So let's say if you're removing wheat and you're replacing it with rice, well, you only want to eat rice once every 4 days, or for a full day for that.
So rotate. You can eat your dinner for your lunch, but then after that you change up. Basically, that's what I remember doing with you. It's really hard, actually.
It is difficult.
I found it extremely difficult to do that. Especially feeding a family.
Yes, it is difficult to do. So that's why we want to choose the right people for it. So, like I said, I think anybody can benefit from it, but you really have to weigh the who's going to be a good candidate for this, who's going to get a good outcome, because there's nothing worse than somebody putting in that investment, putting in the time, and not really getting out of it what they want to see. So
so maybe get the big ones out first and see how they do. Okay, that's really helpful. So you talked about gut permeability, and you said it was sort of causative for food allergies. I'm confused by that. I thought sort of our repeated abuse of the gut caused the leaky gut.
Yeah, exactly.
Okay, so it goes back and forth.
Yes.
So basically our gut, instead of having tight junctions and being impermeable, now it's gappy. It's like mesh.
Yes.
And so
a swollen mesh.
Swollen, inflamed mesh.
Yes.
That sounds fantastic.
It sounds kind of like muscles when they're a mess.
And the thing is that what I find in allopathic medicine is that all of these things of acid reflux, like, and sinus issues,
chronic sinus
certainly
issues.
gut pain. We do a lot of diagnostic procedures. We do barium swallows. We do endoscopies. We do colonoscopies, and all these different things. But no one is looking. Well, few are looking at food allergies. I've yet to really see it. And then they really like to prescribe a Nexium or something to calm down the digestive tract and
acid blockers.
An acid blocker. So we're really kind of masking what's going on
and making it worse. Yeah.
And I really, to be honest, find that really, really heartbreaking because it's just such a setup for so many health issues and a bad mood. Because isn't it true if your gut doesn't work, it makes you grumpy?
Yeah, we produce and use most of the serotonin is in our gut, like 90% or more, and we think of it as a brain chemical. Well, serotonin is used in the gut basically to suppress the pain that we would get. So it's no surprise that we have gut problems when we're sad or vice versa.
So you get it. Yeah, that's amazing. So okay, so when you're recovering from food allergies, maybe we can finish this without dropping the camera again.
I'm sitting on my hands, so I don't do that this time.
No guarantees, people. No guarantees. Okay, so here we've got we're feeling better. We've done some elimination either on our own or with you, but I know that there's nutrients that really help our gut to heal from that loose junction and tighten up and recover.
Yes.
So I don't know if you want to talk about that or if that's maybe more of an off a visit type of thing because everyone's a bit different, I suppose.
So in general terms, enhancing digestion, that is the name of the game. Okay. Enhance digestion and do stuff that brings those cells back together. And there's a zillion different herbs and nutrients that can do that. Okay. So, and some work better for others than other ones do. So I can have like this perfect protocol that works for patient A, but something else works for patient B. I mean, even between different enzymes, a couple different types of products. So we're always looking to reduce the inflammation, enhancing digestion. That's the biggest thing because that's where one of the things what first goes wrong, because stress decreases the ability to digest. For instance, we were talking about the acid blockers to reduce bloating or reflux. You have to have adequate stomach acid in order to denature proteins.
Right.
If you can't denature them, then the enzymes can't get at them and cut up the individual amino acids. So
she's moving her hands again.
Oh no, okay. So proteins are strings of amino acids, and when you get a short complex of amino acids, we call them peptides, they spell something to the immune system. So if that's completely broken up, even if, say, you are allergic to eggs, if it gets into your stomach and gets completely digested or completely broken down before it presents to the immune system, then you're not going to have a reaction.
Cool. So is that a digestive enzyme? Is that what we should be taking?
Okay. Yeah, so digestive enzymes, for some people, they can take hydrochloric acid or some other acid type product.
That's often in a digestive enzyme.
It's often in digestive enzyme, but I'm really careful with that because people who have inflamed stomachs, they can't tolerate additional acid, so we have to get to a point where they can tolerate it.
So safe maybe to take a digestive enzyme without. And I kind of think if you're over 40, probably you should be taking a digestive enzyme most likely. Maybe. I mean, I guess not everybody, but
it just depends on the individual. Yeah.
Okay, so that's a good. And I've always heard that, like simple things like a bone broth, a really high quality bone broth, is really curative for your gut.
Yes, it contains collagen and nutrients that we don't really get otherwise, and it helps pull those tight junctions together. So because there's collagen in that, that's what makes it, when you do a really good bone broth and it congeals, that's how you know there's a lot of collagen in it.
Is that different than, you can buy collagen powder everywhere now? I'm sure it's different. I'm sure a bone broth has greater value or more digestibility, or
there's just more nutrients in it.
Just more nutrients.
Yeah, lots more nutrients in it. But I mean, there's nothing wrong with collagen, hydrosylated, or Knox gelatin. Probably was the old thing people did for
so taking
nails
that
and hair
might be also quite helpful for you.
Yeah.
Okay.
Yeah.
Is there any other sort of easy tips that someone could do if they know maybe they want to start healing their gut and they?
Yes. Eat whole foods. Cook your foods as much as possible. That is, make your own. Doing organic is another big thing, because if you are putting a lot of pesticides and herbicides into the gut, that's a direct irritant. The other thing is organic foods are more stressed because they have to fight pests and beat out other plants. So their nutrient value is 8, 9, 10 times higher than conventionally grown foods. So
that is I never knew that before. That's really interesting.
That's very basic. And then really looking at eating as lifestyle, and it's a ritual too. It is a health ritual. And if you're treating it as some sort of throwaway thing that you have to do conveniently and fast, you're not going to be digesting. You have to rest to digest.
You have to rest and digest.
Yeah,
that's so key.
Yeah, so taking it seriously, and health is, with few exceptions, health has to be a priority for people if they want to reap the benefits of it. A lot of people can get away with, we'll just call it dietary murder, and they're fine. Well, at some point, for most people, that's going to catch up. It's going to catch up, yeah, especially with women in menopause, because there's a lot of changes that happen in the gut at that time.
Okay. So the tip is then to enjoy, go Italian. Right? Take some time with your meals.
Yeah, take time with your meals.
Socialize, eat slowly, relax.
Yeah.
I mean, most of us, that's really hard to accomplish.
Yeah.
I know in my family, we're pretty good at dinner.
You're very good at dinner.
We sit down, we have fun, we have a nice relaxing dinner, but my lunches are not so great here. I eat and chart and so I've got to get better at that. But I think that's really important, because stress does shut down the digestive system.
It slows it down.
And it slows it down. So we've got to take a little time to eat, take a little time to breathe, take time to relax.
Yes.
And that's key as well.
Yeah.
So
it's taking the time to eat for digestion, but stress also breaks down the gut barrier. So all stress hormones are catabolic, so they break down everything from the gut to the bones to hair loss to skin sagging to muscle loss, everything. So modulating stress is the big one. But ultimately stress is the cause of food sensitivities.
Okay, you heard it here first. If you need to get some help with this, Dr. Rebecca Hoppins, Seattle Naturopathic, she has a website.
Yep, seattlenaturopathy.com.
Yep, and she's the place to start. I send most of my people to you.
And they're always doozies.
So if you're a doozy, don't be afraid. Just call Dr. Rebecca. So thank you so much for listening. We're sorry for the tech difficulties. Next time we'll have help. Okay. Have a great day.